Good evening, good afternoon, and good morning. This is the 1568th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Azra TP from Kerala country. And the subject of discussion will be management of piles, fistula, and fissure with homeopathy. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. All these sessions are going in a good way, and the first session of the day is already over in Hindi. That is from 7:30 to 8:30, and from 8:30 to 9:30, we have a local language session in Malayalam. 8:30 to 9:30 with the international session in English, and from 9:30 to 10:30, a local language session in Malayalam. All the videos of the sessions will be uploaded on the very next day itself, and those who misses the session can watch it again tomorrow at the same time in YouTube. So let me introduce the guest of the day, Dr. Ayshath Azra, TP, and let us discuss about the subject. She will be talking about a very important subject which easily every homeopath doctors can manage. That is management of piles, fistula, and fissure with homeopathy. We have discussed the session, so the subject many times in this forum, but each presenter has a different outlook and different way of presentation. So we proudly welcome Dr. Ayshath Azra to this session. Please, Dr. Asad, Ayshath Azra, please raise your hand so that we can identify. You're joined by, yes, I can make you co-host. Yes, please open your video.
Okay, sir.
So we welcome you to this session, Dr. Ayshath Azra.
Thank you, sir. So actually, I want to share that screen recording, sir. So I was searching for that 1 second. Good evening, everyone. Actually, I am here going to start about hero that day-to-day life now. Everyone issues and all. It's quite common in we can see that those diseases. It's quite common everywhere since the computer lifestyle. Many other causes are there actually. So I like discuss class and all. So I'll have like little presentation after which everyone can discuss about it for your experience and everything about all these diseases like anorectal diseases. Okay, first let me share that screen. See, first of all, I would like to discuss about that hemorrhoids things. See, hemorrhoids is the one among like anorectal diseases. So he first of all he the word will let us describe from where it was the origin and all just for knowledge. Okay, so derived which means flowering, and the piles which is derived from like Latin word pila which means the ball. So what is it, definition? It will be like it is the abnormal downward sliding of anal cushion 11 o'clock positions. Okay, so wrong. 1 second. Okay, next let's go to etiology. So here only few etiologies I have mentioned just for like slide making and all. So everyone like which can uh, low fiber diet will be there. It can be due to hereditary also, and even like rectal vein will not have like walls, no walls will be there. So that can also cause to hemorrhoids. And many like continuous constipation also can cause that. Even obesity has is one of the reason. And even continuous diarrhea or acute or chronic it may be, that can also cause hemorrhoids. And even colon cancer or any prenatal surgeries, everything can lead to hemorrhoids. Okay. Then when it comes to types, it will be like internal or external and intro-external. And usually in internal thing, there will be or 7 o'clock position or 11 o'clock position piles. And in external, there will be like externally we can see that protruding piles outside. And intro-external means both can be seen. And one more thing, like can divide it like in types, like four grades division. Like first of all, which will be internal, which will be bleeding, and second will be like prolapse will come, but it will retract back spontaneously, and the third will like it will come like progression will be there, but we should retract it back by manually replacement should be done. And like final thing is like permanently it will be outside. So this is just showing the figure of hemorrhoids. Uh, as I said, like classification before also silly, like grade according to Goliger's classification was that one. And one of the other classification is primary hemorrhoids and secondary hemorrhoids. And primary hemorrhoids will be which is related to branch of secondary will be related between that it will be okay. And this is the position where we can see like 3 o'clock, 7 o'clock, and 11 o'clock. And when come to incidence, it will be quite 1:1 ratio only. It can be seen in male also, female also. Like one is will be there, like and bright will be there. And mass per annum, and discharge will be like mucoid discharge will be there, and along with that, pruritus, pain, anemia, blood loss, that anemia can be seen. So these are the some symptoms which I mentioned, but now let us go to examination. Like if we can examine piles like manually, like if we internal piles is there means if you put examine inside, which we have to use protoscope, and manually if it is external, it can be anywhere every seen outside at pile also, like in which is described in our materia medica, like in different remedies. Okay. Even differential diagnosis of piles will be like CA rectum, rectal prolapse, and perianal wart also. Coming to complications, when it comes complicated, like too much bleeding can occur in some cases. It can occur, thrombosis also can be seen, and prolapse of rectum can occur, and ulceration can occur after there. And even rarely portal pyemia or which can occur after surgery, like rarely, it is rare cases. And treatment, we usually this is like supportive treatment, like sitz bath laxative can be given, and alternate fiber alternative, as everyone suggests piles patient to do. And even like injection. This is like a allopathic way of treatment. Banding can be done so that piles can be removed and all. But let our part of treatment, when we comes to our part of treatment, it will be everyone knows like many remedies are there according to our symptomatic treatment, and mainly we will be giving whatever it may be, piles, fistula, fissure, whatever it may be, we will be mainly for things, no. So now external hemorrhoids pending. Okay. See, one more thing is external hemorrhoids also is there. Like we can see like thrombosed extended piles is called perineal hematoma, and sudden onset olive shaping swelling, painful blue in color at the anal margin. These are the these are seen in the external hemorrhoids which we can see. Okay, like it will be sudden onset and the shape will be like olive swelling shape. It will be there. It will be painful and blue in color, and it can see if you're treated, it will be like can cause fibros. It can, and even cutaneous tag, or it can burst and clot, or it can bleed also. This is one of the peak of external plights which goes to hematoma. And when it come to anal fissure, see, anal fissure is also, and if come, it is a line which distal and anal canal which extend from anal verge proximally but beyond the dentate line. Most frequently affected portion is posterior midline and reason not understood. Cause is like strained evacuation of hard stool, repeated diarrhea following vaginal delivery of anterior anal fissure. See, anal fissure is also quite common in each nowadays. Actually, in every clinic we'll be seeing in these cases also see. And most commonly, like mainly what happening in this time is, I think, like diet and like sedentary life is the main thing, main among causes which is causing all these things, even whatever it may be, piles, anal fissure, or let it be fistula also. And this is the one of the peak of anal fissure. So next, and types, when comparing like when come to the types, it may be acute or a chronic. Okay, so in it will be like ulcer will be like in the midline of an anal canal. When seen at the unusual site, one should suspect a more sinister cause like chronic inflammatory diseases or malignancy. If it is seen unusual site, we should suspect like any inflammatory disease is there. Okay, and symptom will be like very excruciating and cutting pain will be there after or at the time of defecation, and the bleeding will be the bright red and with mucus discharge and pruritus, and constipation will also be there in most of the cases. And the bleeding, everyone knows it will be in stool, like streak of bloods. And when come to treatment, it will be again our treatment part is different. And when compared to conservative management, it should be like laxativity should be given in the heel parts and application of any anesthetic, and even suggesting like same diet to patients. This is the allopathic part they are doing, and a main thing is like fiber content. Main thing we are suggested for that hemorrhoids also, that same will be there followed in this also, like diet chart and all. And next, let's goes to like fistula in ano. So it is the definition is like it is an abnormal communication lined by granulation tissue which runs outward from the anorectal lumen to the external opening on the skin of the perineum or buttocks. Okay, that causes may be like any chronic abdominal conditions or any inside any gut diseases like Crohn's disease, etc. Or many are like with idiopathic cause also, and any previous history of drainage of anorectal abscess also can cause all these things. This is one of the diagram of anal fistula. And when coming to treatment of anal fistula, it is like see, fistulotomy is done in the allopathic session, and even in our case, just for reference, in our case, all treatment will be always different. Like we'll be dealing you. Okay, Guru. Actually, this is small presentation what I prepared actually, because so better I would like to go into a discussion session. It will be a lot further, so that everyone can share their experience on these diseases and all, whatever maybe then the in clinical practices. Hello.
Yes, thank you, Dr. Ayshath Azra.
Oh,
You may stop, shall we stop the screen sharing? Yes.
sure, sir.
Yes, I am stopped. Please wait, I shall do it.
Okay.
Okay, I have done. Anyway,
Okay.
it's a very, very short presentation.
Yeah,
Suppose
sir. Actually, time was not. Our working hours is so long, so I got little time only.
actually it is
But
a
I thought it will be like discussion session will be the more comfortable.
no problem with that way, but unfortunately, most people, I don't know how many of them will participate in the discussion. Anyway, the subject is a very good one, and people used to, most of the homeopathic doctors get such cases every day, every now and then. And how one can manage this is very, very thing. But from my point of view, I have treated so many cases of this fistula, and this hemorrhoids, then piles, protruding piles, as well as fissures. All these anal abscesses also. All these things
Okay.
too, we can call it as hemorrhoids or piles like that. In the single term, we used to say that it's a piles, but all these are the four components of these piles. And usually, if you go and watch what is the reason behind this, you can find that most people give importance to food. But on my point of view, it is not the food is a secondary thing. But what is the more relevant is the most important cause is the mind. The most important cause, what we have seen is the stress of the person, because you may find that there are a lot of stresses come every day. For example, for a child, he may have exam, but he may be afraid of exam. In those cases also, when he passes stool, he may find it very difficult to pass the stool. For example, if you have a love affair and still it is going on, but the family members are not aware of it, though you have to hide it. Then in those conditions also, you may have these files. And then there are different conditions where particularly the people who are taking regular medicines from the other side, the allopathic side, the modern, so-called modern medicine, maybe a big problem. They may suffer a lot because of our medication. And when a person comes to a gastroenterologist or somebody like that, the physician, they may prescribe medicine for that. But when taking this medicine again, thing may get worsened, because the person cannot tolerate those medicines in that way, but still the stress remain there. So in some other cases, you can see the people who use the different type of eggs, particularly egg of this chicken is doing more than the natural chicken. I mean that the original chicken, not the boiler chicken. As far as the meat of the chicken is also concerned, there is a difference. What I felt is that the um, uh, chicken of the natural chicken, egg of the natural chicken is making more trouble than the boiler chicken. And the meat of the boiler chicken is doing less harm if you take it in a half cooked way, that is cooked way, rather than fried one. The people used to make biryani, fry and everything after frying the chicken, and they make the curry out of it, and then that may make a big problem if you go in the other side of preparation, just doing it simply by cooking it in the normal way without frying, it may do a less harm when compared to that the other side. As well as the spices used is a very important factor. When you use spices of high quality, high intensity, it may make more trouble than if you take spices without much uh, 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 problem. And so these are also things to be combined. But the thing is that most people are not using the proper vegetarian thing along with this chicken, egg, meat varieties of milk. If you make a compromise in between that, you 50-50 like that. When you take the chicken or meat, you can take 50 into that, and you can take equal amount of vegetarian diet also in between. Then you can avoid that much of a problem in this piles also. But we can see a lot of piles cases coming after, particularly there is a feeling, there is a proverb that piles, there is no man without piles and women without leukorrhea. But frankly, nowadays we find that lot of women are struggling out of these piles because of the stress they undertook during their life. And we find that a lot of cases are coming after surgery. They're not simple surgery during delivery, the streams of delivery, including the hysterectomy also, we can find such cases coming after. That means there are a lot of stresses during the time of pregnancy. That may be the reason. Of course, they may additional factor will maybe the excess amount of medicine, large quantity of medicine or the antibiotic they are taking during the delivery time, may be the reason. But whatever may be, one need to adjust the diet in such a way that is they take maximum amount of fruits, vegetables along with meat. No problem. You can take meat, but no need to avoid the meat to protect the. And there are a lot of people believe that the alcohol is doing more damage than cigarette is doing. But frankly, cigarette is doing more damage than this. I may say this. Alcohol. I have seen a patient who is fully always take a half pint of liquor every day. He's a helper in construction field. Used to have prolapse with came with his wife to the clinic, and what I observed that the rectum was prolapsing, protruding like anything. It was a big one, and after he used to take at least one or two packet of cigarette along with the same. Um, and I just asked him to control all these things. And after taking homeopathic medicine within 4 weeks, 3 weeks, he become normal. And he some 3 to 5 years has gone already, but still he is having no piles. Still he is continuing this liquor as well as cigarette, but he is controlling the cigarette comparatively what he used to take in the early part. So that means that even without removing all these obstacles, one can cure piles with homeopathic treatment. That's what I have seen in from my experience. And of course, it's the time for discussion. I invite all of you to participate in the discussion, and you give additions to what Dr. Azra Ayshath has given to us. Those who want to participate in the discussion can raise the hand so that we will allow you to unmute yourself and you can talk to this forum. I invite Dr. Hariharan. He is one of the former uh, chief medical officer retired from government service Kerala. So, sir, you can speak now. And if others also want, please raise your hand. You can ask your questions also. This is that.
Hello, hello, Dr. Danesh, Dr. Aisha. Okay, good
Yes,
evening.
sir.
Good
Good
evening to
evening,
all.
sir.
Good evening, good evening. See, I attended the forum to hear more things from you regarding
Yes, sir.
hemorrhoids. See, all the homeopaths are treating for hemorrhoids. That is, it is a see, a hemorrhoid case curing is easy to homeopathy. Very easy to homeopathy. But we must take the case
Yes.
completely.
Yes.
We must take the case. And actually, in my experience, what I am ready to tell, how I am taking the case regarding hemorrhoids. Usually, I am getting, see, constitutional remedies I am prescribing. That 2 or 3 is lycopodium, merxol, naxomica, sepia, lacasis, calicar, etc. Usually these medicines are I am using for these hemorrhoids. See, aloes, one of the best remedy for protruding hemorrhoids. You know, while we are treating the hemorrhoid cases, surely we must go to the thermal reactions. That is very, very important. See, suppose a patient come to you and see that patient is a hot patient, and the patient is getting relief by the application of the relief by hot application after the defecation, and drinking hot water and bathing in cold water, and drinking hot water, bathing cold water, and he always want a fan or AC. See, surely we can prescribe the lycopody. No doubt in that. That will give very fine result. See, you can use higher potency or 50 millismol potency. Along with that, you can use some pathological remedies also. That later I will say about that. See, about regarding merxol, it is not like that. Merxol is an amphithermal patient. He want always warm water to bath. And after defecation, at the inner part, while he is washing, he is getting very good relief of tenesmus, and he is sitting the see that closet long time, because that patient is having tenesmus. That tenesmus is relieved by the application of cold water, and by thermally that patient, while he is going to the bed, always he switch on the fan. But after some time, he will cover complete his body and off the fan. And so much other symptoms are with that. So such a way, you can prescribe merxol higher potency, or you can use the 50 millismol potency. See, Dr. Dhanesh, you must say while any other persons showing hands, you please tell me that to giving a chance for them.
Yes, definitely. I shall come up.
Then another patient is, Naxomica. Naxomica is having wonderful action on bowels. You know all this wonderful action on bowels. See, a patient who is drinking, he is using alcohol, and so much of this, see, alcohol and sedentary habits, and he is using this chili, a lot of chili, and highly ambitious, and irregular diet. Such a patients, we can prescribe Naxomica. Naxomica, higher potency. You can prescribe, and it will give very fine result. And see, management of these cases already said, Danesh said that I am not going to that part. See, next is sepia. Sepia is one of the main medicine for this hemorrhoids. The particularity of the sepia is that oozing from anus, a sticky fluid that always oozing from the anus, and the patient is, you know, sepia is a chilly patient, and she is having very much indifference. That is the PQRS of sepia. Indifference will be there. And another mental symptoms, if she shows that surely sepia will do, and that patient will that cured by that sepia. See, another medicine is, you know, the lacosis. Lacosis is a hot patient, and see, the PQRS of the lacosis is that the patient is jealousy, loquacious, and suspicious. And that patient will be hot patient. And the piles appearing at the time of the menopause, you can use this lacosis. And the pain at the region of the anus is relieved by, see, cold water. Cold water, that is relieved by cold water. That is lacosis. And see, lacosis is having pain also. Pain, severe pain also, that area. See, I am telling in nutshell, and you have to elaborate the points by reading the material medical. See, these are all usual medicines, constitutional medicine. Other medicines is a lot of other medicines also. If you are getting that constitutional and thermals is correct, very easy to manage hemorrhoids. Then some symptoms. I try to say that fissure of anus and splinter-like pain, you can use nitric acid, one of the best remedies. See, the piles, if itching is there, severe itching is there, that you can use rattanhia. Rattanhia is also having pain at the anal region while that patient is having this hemorrhoids. See, another medicine for itching and crawling is ignatia. You compare that medicine and give the exact medicine. You know, I already said that sepia, oozing from anus, hemorrhoids with the oozing from the anus, that sepia. And another bleeding remedy, important bleeding remedy, you know, hamamelis is there, trillium is there, millifolium is there. We can use these medicines. Another medicine is that is mucuna, one of the main medicine for bleeding pains. Bleeding pains, we can use it by comparing the symptoms of these medicines. You can use the hemamelis, trillium, millifolium, and mucuna. See, certain patients we come to our clinic is having profound prostration. Days together they are suffering by bleeding, and if we examine, we can see it that shows severe anemia. So such a patients we must give the China that will compensate the dehydration, and the anemic phase in shortly, and after that you have to give Ferromet 3x 3 times a day and Ferromet 200 weekly once. Suddenly the patient will get relief, and you buy, and then you take the case, you give the constitutional medicine, and the patient will be cured. See, another patient I already said, painful piles, that bleeding will be there. In certain patients. That patients we can try the laxative. That the patient should be, I already said that should be hot patient. Another patient, hemorrhoids, if that patient is having back pain, severe back pain after defecation, he can't rise from the latrine, I mean toilet, is because of this pain. Such patients, you can use Aesculus in different potencies. You can raise it up to 10 m. Such patients, you can give the Aesculus is one of the best medicine. Then another medicine, I already said that aloes. Aloes is a wonderful remedy for protruding piles. In my experience, I have cured a lot of cases. Even a 6-month child, parents came to my clinic, and I really wondered how it happened. That piles is protruded outside with red color. First of all, I thought that to refer the case. But again, I told that the parents, you try for 2 days and tell me. I gave aloes 10 m, 1 dose at the time itself. And there's some, there is no, do not want any placebo, and you take the child to your home and tell me after 2 days. But next day, that the parents came to me and told me that thing, that protruded piles is vanished. It is a wonderful experience. In adult and aged persons also, we can use these aloes, but aloes high potency should be necessary. Thus, next year already you told that painful piles with the relief by hot water. Usually, you do not allow the patient to sit in hot water. If the patient says that is relieved by hot water, you can prescribe that lycopodium. That usual management by the allopathic persons are that you take 1 basin, 1 water, and put some hot water, warm water in that, and they will give some medicines. I don't know what is that medicine. And you sit on that. But usually, if the injury is there, I will say that take a basin and put some cold water, and so calendula tincture, you drop the calendula tincture, 25-30 drops of calendula tincture, and sit in that basin for half an hour. If any injury or a crack or anything else are there, the patient will, next day the patient will cure and apply some calendula oil that area. If fissure is there, that will be cured. And give the constitutional medicine like Merxol or nitric acid or fluoric acid or anything else. Anything else. See, next what Dr. Danesh said is correct, that certain patients having protruding piles or hemorrhoids due to the time of pregnancy. For that patient, podophyllum, you give podophyllum high potency, and you can use along the high potency, you can use the low potency also. In my experience, simultaneously it will act well and the pregnant lady will get relief. After delivery, sometimes it may arise. Such cases, you can use the constitutional remedy and the other pathological remedies also. See, another medicine is that peonia. Peonia is one of the best medicines. Peonia. That different cracks will be there. For you can use peonia for that. See, another medicine, pain exists after defecation, hours together. Tuja is the wonderful remedy. You try it. Tuja. You give it high potency. Vannam. After that, you give the drug. That pain will last hours together. That is Tuja. These are medicines. Then see, teenage girls. One of the medicine is there. If the hemorrhoids suffering by a teenage girl, that muriatic acid is one of the muriatic acid. You know, muriatic acid is a very good remedy for fissure also. If you are not getting the relief by nitric acid, next medicine you try the muriatic acid. Already Daniel said the management that I am not going to that. You avoid. Surely we must compulsory say that you don't use red chili. Red chili is the best villain. See, for this hemorrhoids, painful hemorrhoids and burning at that area. That is red chili. So avoid red chili, and they can use this. I mean, what is that? Pachamalaga. We will say in Malayalam, Pachamalaga. They can use it. Or Kashmiri chili, they can use. It is having not so much, this thing, and some ingredient, karam, and that not much in that. And they can use it slightly, you can. Strictly, I am avoiding that chicken. Either our local chicken or the other chickens, that also I do not allow. Egg also I will avoid. And meat, red meat, compulsory we must avoid the red meat. And take fruits, a lot of fruits, any fruits they can take. Then certain fish also doing harm to the hemorrhoid patients. That in Malayalam we can say, prawns. We will say konj. See that another certain this kakka. We will say in Malayalam kakka irasi. That is doing much harm to the patient. And another crab, that will also. These are the foods which is having so much heat, producing heat, metabolic heat, producing. Usually, hot patients are, I'm seeing in my experience, I am seeing a lot of patients having, hot patients is having this. See, I am stopping. Dr. Danesh is raising the hand. Okay, you can do. You can go ahead, Danesh. Not hearing. No sound.
Please unmute, Dr. Danesh.
Not
Dr.
able to
Danesh,
hear.
unmute.
Not audible.
Yes. Now it's rolling.
Okay,
yes.
now okay.
Thank you, Hariharan sir, for giving a brief idea about the management of these files with the homeopathic medicines. What all medicines you describe are really excellent, and some I think there are some only very few medicines you are missing there. Sulfur is also one of the best remedy for these piles in the all kind of piles you can use sulfur. But the thing is that you will have to observe whether the patient really requires sulfur or not. And the second part is that not then calcarea carb is another remedy, which is very essential in managing this files in those situations which where symptoms favoring in that way. Another remedy that comes on the way is calcarea force. Calcarea force and calcarea floor can do excellent job in these these files situations. And another, I think phosphorus is one of the best remedy also. I think, sir, because of the intensity of medicines there with Hariharan SARS are missed it, but that is a very important medicine because of burning, prolapse, bleeding, all those things, the bright red. But the quantity may be little less when compared to other medicine, but the stress, phosphorus is also very good remedy. Sir has talk about podophyllum. And that's a very important remedy. The painless piles, protruding piles, of course, that high potency is the best according to Hariharan sir. That's also a very important thing. The management is the most important point is after giving the medicine, you have to take control over the patient, and you can manage the patient in a better way. That is what is required for the cure of the patient. Definitely, homeopathic doctors can cure piles in whatever situation, whether it is first stage, second stage, or third stage. But only there are cases where come to us after surgery. In those conditions, also we can do with our medicine. But the thing is that you will have to look into the reason behind the illness and what are the causes, predisposing factors that resulted in this kind of disease in that particular patient. So the most important point is, as rightly pointed by Hariharan sir, is that detailed case taking, the cause behind the illness is more important than the disease itself. And that's what I would like to add. But I think Hariharan sir want to add something more. So so you can say, sir.
Sir, sir, okay. That phosphorus is a wonderful drug. What Dr. Danesh said is very correct. But along the phosphorus, you can use for bleeding pipes. If any medicine you use, see calcarea force, one of the best remedies success. You must use along with that. See, calcarea carb, Dr. Danesh said is very correct. Graphite is one of the best remedy. Graphite is, if the constitution is correct, graphite is will cure easily. Graphite is cure the hemorrhoid patient. See, you must differentiate the calcarea carbon graphite is separately. Why I prescribe graphite is and why I prescribe calcarea carb? You must thorough knowledge with these two remedies, because both of the patients they too are fatty. But if we touch calcarea carb, we can see the very soft, very soft, fatty and soft also. But in case of graphite, it is not like that. That graphite is somewhat muscular. If you touch the patient, we can see that. And the graphite is a constipation patient. That is the prime indication of the graphitis.
Yes, sir. Yes, that also is a very. These medicines are also very excellent for treating. To me, the best remedy, as far as from my experience, is Natamol.
Hey, I said that constitutional medicines
Yes,
are
yes,
very fine, very fine. So I said only few medicines. If you
yes, yes,
go
sir.
through the case taking,
You told about most of the medicine that can be used for definitely all these medicines are excellent in curing these cases on a condition that you're choosing the right remedy with the right potency. Definitely, homeopathy doctor can achieve the target, that is curing the patient. Simply managing the patient is different from curing the patient, and by using the right remedy, one can go ahead in treating, not only simply treating or managing the disease, but curing. That is what. Oh, yes, our Amir Malik's doctor is here. Let us welcome Dr. Amir Malik. Please unmute yourself. Okay. Oh, once again.
Hello, greetings, namaskaram to everyone, all our honorable doctors and members. Hello, Ifph, the great platform, the world's #1 platform. God bless you all, doctors and members, with special love and care. And today topic is very interesting. It's a great homeopathic is a great platform for humanity. I believe as Honorable Dr. Azra today they have differentiate the fissure, the fistula, the piles. It's a very big thing because number of people after the surgeries, if they have go for 2 or 3 surgeries, they even cannot sit on the seats. This is their tragedy. And homeopathic is the system of medicine which can help them cure them from the fistula, from the fissure, from the piles. As well, I have treated the fistula patient, the fissure patient, the piles patient. He is the professor of Punjab University in Lahore, and his wife is the peds specialist, and she can't treat his husband. And he was totally disappointed, and he comes to me 2 years back, and he said, "I am very disappointed. What should I do? Is there any medicine which can cure the fistula?" I said, "Don't worry. God will help you. You will recover." There is one finding from my side for the patients of piles, fissure, and fistula that they should not eat chicken. They should not eat eggs. They should avoid the meat. And the reason is this: whenever the piles, fistula, and fissure occurs, the liver get weak. It cannot metabolize the energy of the food. This is the reason why they suffer from the piles or the fissure or the fistula, and the bacteria. Why comes continuously? The bacteria increases in the rectum. This is very important, how to reduce the bacteria level within the rectum and how to accurate the liver function. So I use also the back flower chokori. That's very effective in the piles, in the fissure, in the fistula. It will give the immediate relief. If there is a lot of bleeding, milifolium is very effective. If there is a pain, a critical pain, if you want to give the immediate relief, sulfur CM works incredibly, give the relief in the pain with mixed with the belladonna CM. And for the long time to recover the infection level, I use the pyrogenium and one more medicine, baptisia. Yep, it also work very well on the rectum infection. So today topic is very important, very good, Honorable Dr. Azra. I appreciate it. You have chosen an excellent selection of the disease. It's a really great thing. And have a lot of medicines which can kill the virus and bacteria, but they are not highlighted, especially in fistula. There is
Thank you.
very good medicines.
Thank you, Dr. Amir Malik, for coming over here after a long gap and sharing your experience in this field of piles. And it is the time to wind up the session. I invite Dr. Anju to say a word of thanks to Dr. Azra Ayshath.
Thanks, Dr. Danish.
You're welcome, Honorable Sir.
Is it audible?
Yes, yes.
Yes, please.
Yeah, as I'm currently outside, I'm unable to switch on my video. I hope this doesn't cause any inconvenience.
No, no problem.
Good evening, everyone. On behalf of the IFPH and all attendees, I would like to express our sincere gratitude and thanks to Dr. Ayshath Azra for delivering such a interesting section today on the management of piles, fistula, and fissure with homeopathy. Although the subject is very vast and highly interesting, our section was quite short. But don't worry, dear doctor, if you are new to this platform, and definitely we will have more opportunities in the upcoming sections, and I'm sure you will bring up even more engaging topics to the table with ample time of discussion. Also, I would like to express my sincere thanks to Dr. Danish and Dr. Hariharan, and one more doctor, I forgot his name. You all have beautifully explained various homeopathic remedies and their applications in treating these conditions, offering us a deeper understanding of how we can approach these challenges with holistic perspective. Also, special thanks to all the participants for their active engagement toward the section, making this webinar more enriching for everyone. Also, I would like to take a moment to express my special thanks to Dr. Abdul Salam sir for inviting me to say the vote of thanks today. Once again, thank you to all.
Okay, thank you, Dr. Anju.
Okay, sir.
Okay. With that, we come to the end of the day, 1568. Thank you, Dr. Ayshath Azra, and those who attend the session once again. And tomorrow we will have a session from Dr. Professor R.D. Patel. So we'll be talking about lesser known about Hahnemann and homeopathy. That is a very philosophical subject, always very interesting. Hope all of you will be with us tomorrow at the same time. See you all. Good night. Over to our Malayalam model. Yes, Dr. Aysha, you want to say
No,
anything?
no, sir. Okay, going.
It's over to our Malayalam team, Dr. Mariamma John, to moderate the Malayalam session. Good night.